So nice to have you on this bar talk again, Lucy. That's really a great pleasure having you here. So we will talk about the report, Reimagining Global Health Through AI, the Roadmap to AI Maturity. This report is also in the resource section on our website. So it doesn't surprise me that we don't have that many raising hands with regards to artificial intelligence. So I think, Lucy, you will have to tell us much more about it. And so in short, what is the role exactly of Novartis Foundation on the development of the Broadband Commission report? What is it about?
Thank you, Carine, for the question. And AI is a very broad topic. We'll probably be able also to share the link to the report in the chat for those of you who haven't seen the resource section yet. But, you know, AI is just the next transitional step from purely digital technologies towards, let's say, the next cutting-edge technology. And it's not even the most cutting-edge technology anymore. Actually, AI starts to become, in certain locations, in certain geographies, AI is already a core component of health systems. And in fact, if you come to think of it, for those of you who haven't really reflected, AI is also a core component of our day-to-day life. And I'm not talking about health systems necessarily. Google search, Amazon, Spotify, all the very big, let's say, platforms that you're using today, all of them, they're using artificial intelligence to help support the choices you make, to help support the translations you receive, to help support find information that's, well, not always accurate, which is one of the problems probably of AI, of not being perfect, just like Stefan mentioned earlier. And as such, AI has a growing and even more important role in the last couple of years in the space of health, which is why at the Novartis Foundation, we started transitioning from purely working, let's say, into the more analog way towards digital health. And now in the last couple of years, I would say, and even more in the coming year, towards working on the basis of artificial intelligence and data. Now, what does it mean? Maybe some of you already know, for the past couple of years, we have been the co-chair together with different technology partners and non-technology partners. We've been co-chairing the working group on digital and artificial intelligence in health, part of the Broadband Commission, which is sitting under the UN organization. Now, the Broadband Commission has been set up 10 years ago, especially with the goal to support the reach of the universal health goals, for sustainable goals. And health is one of those key goals. And we believed that this transition and the opening of the topic of around AI is extremely important, because the potential which AI holds is absolutely fundamental, because it brings a promise of speed, a promise of accuracy and scale, which the current technologies so far haven't been able to fully fulfill. So essentially, it's a key tool which has to come into the hands both of the users, the people who are actually going to benefit of the value of AI, but also the people who are going to use it in their day-to-day work. So maybe that's just a little bit of a basic introduction. But obviously, the work which we are doing with the Broadband Commission is enabled by a huge consortium, let's call it like this, working group of partners from the public sector, the private sector, non-governmental, and all of them has contributed vastly to this piece of work, which was launched in September, and it's publicly available. And what is special about this report is that it's not just another report. In fact, it's a framework which offers very actionable recommendations for the different stakeholder groups working and enabling successfully leveraging artificial intelligence for the purpose of health system strengthening, not only in high-income countries, but also in low and middle-income countries. So we want to look at AI as equitable. That's number one thing.
Exactly. We will go into the recommendations of this report a bit later. Before we go into that, I think in the report, you mentioned 6 areas which are important for artificial intelligence. And I prepared a slide, and maybe you can walk us through so that we can better understand what this is all about.
These are actually the core 6 areas enabling the framework which the report is introducing. And I believe that Stefan touched upon some of those areas quite nicely, because all of them are of our utmost importance to be able to deliver equitable leverage of AI in health, not only in the locations in which we are today, such as Switzerland, but also in low and middle income settings. So the number one key areas you can see, and it's not number one in terms of priority, but just on the picture there, it's people and workforce. The role of education, upskilling, and transforming the skills and capabilities of health workers, but also of patients in using technologies and using solutions based on artificial intelligence is absolutely essential. Just the great question, or the great statement which Stefan did earlier about basically people not, so health professionals not being able to use AI are going to be replaced by those who are able to use AI. This is essentially at the bottom of all of this. So skills around developing data science capabilities, both on policy level, meaning the policy teams working on policies, leveraging technologies as such, are extremely important, but also the purely technical skills are very, very important as well. So several years ago, disciplines such as data science basically didn't exist. At the time, it was more classic information technologies, programming, and now data science is a very important piece of the curriculum of education systems across the board for the whole of the ecosystem. This is the number one message here, because there is going to be a whole new set of jobs, and some of them already are being established. And it is in our responsibility, but also opportunity, to think what are the prerequisites to upskill the people with which we are working, the people in this ecosystem, in order for them to be able to use this in their day-to-day life. The number one, and not surprisingly so, is data and technology. Now, many people believe that you need a vast quantity of data in order to be even able to start with artificial intelligence. But even more so is true that you need data foundations and data strategy, enabling you first to collect the correct type of data, to be very clear what are you collecting it about, and essentially to be structuring it with such a quality that you know you can trust it. And we talked a little bit in a previous session about trusting the AI, and this is where it comes from the quality of the data. And it's absolutely essential that the data is there for you to be even able to use this as a technology. In governments, in government, it's absolutely crucial to think of what are the systems and where is this data sitting when we're talking about health systems. And you have a number of different health systems with different use cases enabling future AI potential. So today, just imagine if you have a simple system in a hospital that you want to leverage for further, let's say, analysis now during the pandemic. And if this system is not connected to specific solutions, providing access to patients, to information, to insights, to guidance as to where they can go and get, let's say, diagnosis, treatment, and so on. These are the type of interoperability challenges which we are facing today. And in many geographies, unfortunately, there isn't even the basic infrastructure for electronic health records enabling this as a foundation. Which leads me to the next piece, which is around organization in a way. It's governance and regulatory, creating the right circumstances, both on a national level, but also on international level, to enable the clear usage, the clear, let's say, rules of engagement when it comes to solutions based on artificial intelligence and systems and decision-making. Because the number one message of AI is supporting data-driven decision-making. But how can you make decisions if you do not have the right governance models? How can you trust that AI works for the purpose which you want it to work for, and it's not used for something else, just like in that Netflix movie? So it's essential that the rules, such as GDPR, are further developed and that they are scaled up, not only in one region, but also internationally. It's also responsibility of the different stakeholders within the ecosystems to be part of this dialogue process, because otherwise we are going to end up in a situation in which maybe the big tech players are going to influence certain decisions, and then the governments won't be able to manage the results of those decisions on time. So the co-creation factor of the platforms and solutions enabled by AI right now is absolutely number one topic. Design and processes is something around which I usually love to talk, because innovation is very close to my heart. Why is it so important in a way? Well, think about yourself. Would you trust something which you haven't been really aware of how is it built, in which you didn't necessarily give input, which just came to your hands and might decide your life, your health, the health of the people you love. I wouldn't necessarily trust that. So if you think of design and processes, we're talking about creating human-centric solutions based on AI. And not only the data is useful, all right, absolutely, it's useful, but without centricity around how actually you're going to use it day to day. Is it made for you? Does it fit your context, even the geography, the culture, the real journey that you're experiencing as a patient? It's not going to be maximum valuable for you, and you're not going to trust it either. So that's essential as part of the process. Partners and stakeholders, without being part of an ecosystem that is enabling each other, even with the best data, we are not going to be able to do much of it. Data is only useful if it's used. Otherwise, it's just bits of information which don't have any value whatsoever. And to enable the successful usages of this kind of technology, today is AI, tomorrow is blockchain potentially, or even quantum computing, then we need to be ready to open the door and start collaborating on things for which we have complementary skill sets and on things which we want to bring the scale. Because AI is all about scale. And if we want to reach more people, given that there is a huge shortage of health workers in low and middle income countries, there is also a huge burden on budgets for governments. And the fact is that today there's so many people which don't even have access to basic health services. We can only do this in collaboration, and smart collaboration, not just creating a huge fragmentation of a number of different initiatives and solutions. And last but not least, enabling these business models is not an easy job, because a key question which usually comes back and forth in our work with startups, with other innovators, with other foundations and governments, is how do you actually make it sustainable? In other words, how do you make it stick? And the question usually comes with a price tag, right? So somebody has to pay the bill of those solutions in the end of the day, and who is going to actually pay it? How are you building a business case, ensuring that the investment that you did in the training of the people, setting up the governance models, setting up the infrastructure, the design and the processes, going to test it in the field with the patients, with the doctors, the nurses, and creating the consortium? Does all of this have a return on investment? And what is this return on investment? Is it an economic value? Is it prolonged life? Is it a better quality of life? That's a difficult topic, but we are discussing it in the coming minutes.
Thank you so much for walking us through these 6 areas and breaking down this complexity and making it a bit more understandable for us. It is predicted that the healthcare landscape will completely shift in the coming years, in the next 10 years, especially driven by artificial intelligence and machine learning. The report holds that while low and middle income countries may have the most to gain from the radical potential of artificial intelligence to transform health systems, they may also have the most to lose. What kind of recommendations do you make? How can this report be also used by the Medicus Mundi member organizations?
Thank you for the question, Carine. So as we were discussing, number one message I would convey is simply start, see who are the organizations complementary to yours. If you want to even go in the space of artificial intelligence, it does require to have the right partners. So public-private partnership is absolutely essential. And I know that a lot of the organizations on our call today know that even better than me, probably, because I've been mostly working in the past years more on the private sector and technology innovation part. And in the recent year, by joining the foundation, I've been working more in public and private partnerships. But I can tell you that the impact is 3 times bigger if you work with others. Also because it's absolutely impossible to think that every team has all the right resources, both skill sets, but also purely capabilities and financial resources to go ahead. Usually this quote comes because Obviously, it's easy to think of developing innovations in health systems such as, let's say, Switzerland, which is it's quite developed health systems compared to geographies which are disadvantaged, geographies in which there isn't broadband communication even, or you know, with these wide zones in which you don't have basic access to 3G, 4G, and etc. So thinking of smart ways to build solutions that are scaled from, let's say, high-income country to a middle and low-income country, and the other way around, from a low and middle-income country to a high-income country, is crucial. Because if you can do this both ways, it means that the impact you're going to have is actually a global impact, not just a purely local impact. And this is what we're looking after at the foundation. We're looking at specifically supporting proven, validated innovations in the space of health tech, which can be scalable, so that the learnings also are scalable, but also that the cost of the investment is distributed more evenly, so to speak. So Carine, probably that's partially of the answer.
I think we are opening now the floor to the audience and see what they would like to ask you and would like to hear. And we decided as well, because now we have the big Q&A coming up, also together with Stefan, that I will unmute you so that you can also speak, and then we are kind of in the same room. So let's try this. Hello, Stefan.
Hi. Thank you, Lucy, for your input.
Maybe we start with one question.
Hello.
I can see.
Hello.
Yeah,
Do you hear me there?
We can hear you.
Do you hear me there? Well, thank you. Thank you very much. Thank you, Stefan. Thank you, Lucy. Both of the presentation were just great. Very on point, very interesting within this context of international cooperation and humanitarian efforts, let's say so. And I already asked a question to Stefan. So for me, it's more about with Lucy, because I saw her diagram. I loved it. It's very clear, very specific, very, on point. And my question is about business models, actually. What do you think are going to be the best or the more fitted business models for digital health in emerging economies, particularly like in developing countries and so on? Because we see in Europe that we have like both. We have some of this digital health initiative, which are more non-profits, and we have like almost the half or even more, maybe I don't have numbers of that, which are for profit. But when you extrapolate that to the developing context, they are mostly non-profit. Do you think this is sustainable long term? Do you think it's going to change in a way, maybe become more equal, or maybe go a whole different way? What's your point of view on this aspect?
Perfect. That's such a nice question. I usually love talking about social enterprise type of models. I'm going to give you my subjective view here. It's probably not representative for all the opinions which are on my team or the organization I represent at large. But I do believe that as long as you demonstrate that the USP, so the unique selling proposition of whatever you're trying to innovate in, so the actual solution is solving a particular need, and you can actually prove it with data. You are able to prove that whatever you're putting in the world is solving a specific problem, then you can monetize this one way or another. You can monetize it through the cost of, for example, secondary care. Imagine if the person doesn't enter to the secondary care and you prevent that step. You already saved a lot of costs from the health system. So can't you use part of this cost to fund actually the solution, which is preventing the person from getting even sicker? So that's a very simple example. Another example could be, can you measure the economic value for companies if their employees keep on getting sick? The fact that someone is not going to go to work for a number of maybe months even, and even potentially may lose their life, can you monetize on this? Can you think of ways to prove that whatever you're putting as an innovation in an emerging market could be funded either by the government partially, either by the private sector, and potentially purely into the catalyzation phase, when you first start creating it, co-funded by, let's say, maybe even foundations in the NGO sector? Or do you find complementary skills? If you remove the money element, and if you think, do I have actually the resources? Can I find organizations which have the resources which I don't have? And instead of asking for money, asking for resources, is that another option? So I'm not giving you a black and white answer, but I always think that you should be thinking of how this model, it should be financially viable. Otherwise, it's not going to last for a really long time. And you do have to prove that you're solving an actual problem.
Maybe I can just add here, the digital principles. The UN Foundation is having a group that sort of is hosted by the UN Foundation. It's called the Digital Development Principles. There are 9 principles. One of them is sustainability. And we actually, as a foundation, have been supporting them. They're developing currently a toolkit on sustainable business models for digital solutions, not just for the health space, but general in development, whether that's agriculture. And there has been tremendous waste in the sort of non-profit world in the last 15 years of digital innovations that basically were, people were excited on the opportunity on the tech side and then developed them and used donor money. And we as funders have actually contributed to that wastage. And then, they were not scalable because nobody has thought through at the front end, how is this actually going to be scaled in terms of a sustainable financial model? And maybe just if I can, one example was I was involved a couple of years back in Kenya together with the largest telecom provider, Safaricom, and some actors together with the Ministry of Health to develop a digital health solution for maternal newborn child health. And we wanted to build it from the local ecosystem's own financial resources to have a sustainable business model. The sad thing was that we got very little traction from the international NGOs because it was seen easier to write a proposal to get money from USAID or Gates and fund it than actually try within the local ecosystems of national resources to find a sustainable business model that actually could be scaled. So we are still in that very much project mindset rather than actually looking what are sort of blended finance business models to sustain and scale some of these exciting solutions.
True. Thomas, I would like to give you the floor.
Thanks. Thomas from Medicus Mundi International Network. It's really good to hear your contributions, and I was particularly attentive to what Stefan has been saying. I think we still are in a phase of hype. There is still this push by the providers of innovation, and sustainability is certainly an issue we will need to address also in international health cooperation. The other issue is regulation and the role of state and integration of all those technologies into a national health system and policy. Here I just wonder if we can compare what's going on with what's already established in the field of medicines and regulation of medicines, where we have standardization processes, where we have also authorities who look for the authorization, marketing authorization, and registrations of medicines. Do you think that at a certain moment, this is also something a government, an authority, needs really to care for and play this role? Or do you know about any good practice already existing in this field? Or how would you then define what you introduced as the need for regulation at a national level, but maybe also the global one? Thanks.
Should I go first, or Lucy, do you want to go first?
Go,
okay.
Stefan.
Thank you, Thomas. I do think there is a lot to learn from other domains within the sort of health, and you brought up sort of medicines as one example. Absolutely. I think that there are as well governments who actually seems to really have a good handle on it. And I would refer to Denmark. If you look at, I think it was 2018, they had their new digital and AI sort of health integration strategy document published. And, you know, this is really well done, thought through, considering, you know, the rights to privacy, other human rights consideration. and have taken really a good, ecosystem view on how can we actually tackle some of this and create an enabling environment. Health is a complex system to start with, and digitalization is not making it, necessarily less complex. So you have to embrace that complexity and use an ecosystem approach as you plan these solutions. I think Rwanda is having interesting approaches because of its sort of enabling policy environment around. Estonia has really started to do some interesting bit. I can't talk about Estonia or how much they have considered some of the human rights implications. I don't think so, because I was in a presentation where they shared their sort of access to their electronic medical records, and was a bit surprised that the father had access to sort of the file of the daughter, who was probably 16-year-old, and so that's probably a bit questionable related to sexual reproductive health rights, whether I would want, whether my daughter, I have a daughter, would have wanted me to have access to some of the information. So so that is an example in Estonia, for example, where good intention, if it hasn't been really thought through from a human rights impact assessment and involve all the actors and stakeholder groups and listen to their potential concerns related to such a solution in terms of their violation of their rights. This requires investment. And I think linking it to the Federal Councillor's, Mr. Kassi's talk, I think what we face is a collective failure of investing equally in ethical and regulatory and governance innovation as we have been investing in technology. I mean, you take ETH Zurich and EPFL. I mean, if you look at how much money actually goes into driving new deep tech solutions and the bulk of the budgets, and how little actually goes into the research of what are the ethical, regulatory, governance innovations that should enhance. And then what we have now is the backlash. You basically have technology 20 years ahead, and the regulatory governance and ethical sort of innovations are totally lagging behind. And it's kind of really it's so out of sync that we really need to catch up on this side through massive investments by governments. I would advocate that companies and governments, that they should have, for every 10 million they invest into a technological innovation, they should invest 1 million into the governance, ethical, and regulatory innovation, at least.
Maybe to add to Stefan's point, the private sector since years has been using innovation frameworks. Some of the big companies are using different innovation frameworks, and most of the time their innovations frameworks, unsurprisingly, are driven by their business strategy. Now, if you're a government, why don't you take the same approach? Come up with a strategy for your technology objectives. What are you trying to achieve for your health objectives through technology, and define your data strategy and your innovation strategy as a whole. Not a lot of governments have these capabilities, let's say, in-house at this point of time. And this could be a potential opportunity to look from maybe the book of, let's say, private sector organizations to see how did they do it? How did they establish data strategies and government mechanisms for their own companies if you run the government, let's say, as a similar organization in a mindset? And what governments can do is then, just as Stefan said, is define a strategy on innovation, a framework under which you say, for example, for things which we just want to improve over time, but we're not going to fundamentally change, but just incrementally change over time in our health system, we're going to put, let's say, 80% of our health budget. The rest of the 20% of the budget, we are going to put into an investment towards open innovation, things that are transformative and really bold, and things which are more risky. And if we cannot do it alone, who do we have to get on board to help us support these 20%? So this is essentially the mindset which a lot of these large organizations have. And I think this is something which governments should also quite vastly benefit from in establishing the right rules afterwards to hold themselves accountable, but also the partners who are using the data, which is coming from, let's say, patients and from the public sector.
Maybe just my last point is, I think we have as well to take on digital solutions on how we govern and regulate these issues. And a good example is we are supporting the ITU, the International Telecoms, and WHO focus group on algorithm benchmarking in health, where basically the idea is that you have secure data sets where these algorithms that constantly change, and if an algorithm is developed in Switzerland, doesn't mean it works in Papua New Guinea if it's trained on training data here among a Swiss population cohort. So, but you put it on an app store and suddenly it's globally available, but it might do harm in Papua New Guinea. And so how can you ensure that you have a dynamic sort of regulatory framework that uses actually AI and big data analytics itself to make sure that people who provide these things first have to run it through such a benchmarking exercise before they can deploy it. And as the algorithm changes on a probably quarterly basis or whatever, have to go for that continuous recertification.
Thank you, Stefan and Lucy. That is very, very interesting. And this will also be one of the topics for this afternoon. And we have Kansu Kanka with us, who is an expert on ethics, and she will tell us much more about it as well, and how to apply ethics to our questions. We have two more hands before we will break for coffee. Let's have Hafid and then Martin Raab.
Good morning, everyone. Can you hear me?
Yeah, we can hear you.
Perfect. Thank you very much for the inputs. A lot of food for thought. Very interesting. Thank you also for the answers and discussions that were already provided. I will take up on what Stefan just mentioned in terms of the example in Kenya, where I would definitely agree. I think we all still need time to figure out what sustainable funding models we can apply to in the different countries. My question arises when I hear the discussions. We are working in very different countries, countries with 80% and more informal sectors. So relying on the companies as such is difficult. You mentioned the governance problem. Even the government, to really work on a sustainable ground for long-term investments, etc. MOUs that are reliable, etc. And I'm asking myself when I hear this, do we have to focus, now that we are starting, do we have to focus on certain countries where there is already more or less a formal sector and a good ground to work? Or do we have to use multiple strategies and think of the countries where it's not working? But even, and I'm really, when I ask myself, and even with a country like South Africa, we have regional disparities according to the provinces. And if we want to scale up programs, how do we work? How do we leave no one behind? Because if we want to scale up, it's not just focusing on, like, a lot of the examples when we speak about infrastructure are urban. And I see a lot of shifting also to the urban settings, and with good reasons. But there is also high risk now to increase the gap between rural and urban areas. These are questions that are just summing up. Sorry, it's not as structured, but it's really more questions that arise while I'm hearing these discussions, and I'm taking home also to digest also on the long run. Thank you.
Thank you, Hafid. As time is a little bit running, I'll let one of you answer or give a comment to Hafid's questions. Is Lucy or Stefan would like to answer this one? No one.
I can have a go. I mean, Hafid, critical questions on it's at the core of equity. And that's within country and then between countries. And I think we don't have time, nor is there any easy answer to really find to that. But I think it's as organizations who are facilitating, enabling this in a country, we need to be very much aware of, what are we doing in terms of equity related to that solution. and then look at what are the sustainable resource bases in that context to make it sustainable and scalable. And that is a very difficult balancing act at times. And I think it requires a lot of sort of, you know, context understanding and listening to communities and local actors. But and solutions need to be found within its own context. They cannot be parachuted from somewhere else.
Thank you, Stefan. Let me have Martin Raab. Hi, Martin. We can't hear you yet. Yeah.
Good morning. Can you hear me now?
Yeah.
Morning, everybody. Good to be here. I'm just wondering if we are putting not too much emphasis on AI and all these high-tech technologies at the moment. The topic really is how we can make sure that universal health coverage is being put at the front. And from our experience here at Swiss TPH implementing digital health solutions, one of the big constraints certainly is the low capacity that we see in various countries when it comes to discussing and to implementing digital health solution. So leave alone that there is sometimes not a regulatory frame, that data protection is really not implemented, that you don't have the informatics specialists, that on the governance level, Ministry of Health, you have hardly quite often counterparts that understand concepts of digital health. So I'm just wondering if we should not shift our emphasis a bit and make sure that capacities are built, especially in low and middle income countries, that we make sure that there is not a huge waste of money on digital solutions that don't provide really a good benefit. As you said, Stefan, before, we have seen a lot of waste in this field. When it comes to AI, we know that, that AI system maintenance is very complex and expensive. You said it before, the algorithms need to be maintained and adapted and these kind of things. So my advocacy is rather on, first of all, building capacities in low and middle income countries. And second, making sure that essential health technologies are really in place, such for resources management or electronic medical records. That should be done where we see that there is some proven value for larger populations and where countries really can afford it before we go to higher AI expensive solutions. Thank you very much.
Thank you, Martin. Do you want to go and give a comment, Lucy, a short comment before we break?
Yeah, hi Martin. Good to hear you. I think we've had this discussion many times. It's about striking the balance, right? We cannot start even using such kind of technology if there is no electronic health records to use them with. For example, but we also cannot think of other solutions for, let's say, geographies like rural areas where you simply don't have specialists to tackle the specific need. So to give you an example, and I think I told you the leprosy work we're doing, we are creating an AI for leprosy kind of a screening tool, which health workers can use with almost no training at all, because simply there are no dermatologists who can easily detect and diagnose this disease. So for certain problems, I think AI is going to be really the magic bullet, but not for everything. That's for sure not the case. So the question is, what do you prioritize as a use case for your health system? And every health system is different. But without foundations, without a basic digital infrastructure, you cannot do any of this. So yeah, over to Stefan.